Mastering this first step will help improve your ability to control your pelvic floor muscle movements. Try and approach this from a relaxed and curious mindset and to not demand or force anything. If you do not feel anything straight away, be patient. This is normal when you are working on an area you are not used to focusing on. Go at your own pace. You need a flat chair that's not too high, giving you a 90-degree bend at your knee. Use soft and pliable clothing. As the cushion is easy to wash, you can also be naked. Sit so that this contour presses on the anus. Move gently from side to side or in small circles and notice how it feels. If you feel pain, it might be because the area is tense. Start by sitting so that the pillow does not press too much on the painful area. If there is too much pressure in front, lean back. If it hurts in the middle, bring your knees together and notice that it gives more space in the center of the pelvis. If it feels too intense in the back, lean forward and slowly lean back again, gently readjusting yourself on the cushion while sighing. Now, take a gentle breath in through your nose, hold the air in for a bit and then sigh deeply. Try again. Try to release any tension you are feeling when you sigh. Some people may find it easier to suck and sigh, as demonstrated in the instruction booklet. Place your hands on the edge of your ribs and inhale gently. Feel your chest lift. Hold your breath for a moment and sigh as you exhale. Move your hands further down and feel that area expand as you inhale. Hold your breath again and sigh as you exhale. Close your eyes and repeat the deep, gentle breaths a few times. Notice how it feels to breathe in. Let your entire back stretch with each inward breath. If you are struggling to feel the stretch in your back muscles, make your breaths gentler. Sigh as you go and give the muscles time to relax. Now focus on the sigh. When you sigh, relax your jaw and your lips and yawn. You can also massage your cheeks gently. A sigh can help to release tension both in the neck and at the bottom of your pelvis. Remove the cushion for a moment. Stretch your arms one at a time. Rotate your wrists, stretch out your fingers. Then, sit on the cushion again. You should have started to feel a connection with your pelvic floor. If you need to, adjust the cushion as you have done before. Keep focusing on your breathing. Breathe in, hold the air for a moment. Sigh. Now, practice blowing out instead of sighing. Place your hands on the edge of your ribs. Inhale and exhale. Feel how your ribs contract when you exhale with power. Empty your lungs. Take a breath and sigh. Repeat a few times, holding the air in each time and ending by actively exhaling. Try, if you can, to exhale with pursed lips. Sigh again. Take another breath and exhale, blowing out in short bursts. Close your eyes and turn your attention inward. Keep on breathing in and blowing out. Exhale more gently when you feel a reaction inside of you. Purse your lips when you exhale, and the muscles in the pelvic floor should naturally contract. They pull forward and slightly upwards. Close your eyes. Breathe in. Exhale. You should feel the muscles moving forward. Keep practicing if you don't. Again, fill your lungs with air and sigh. Next, we will make sounds and consonants, which cause small movements in the muscles of the pelvic floor. Close your eyes. Turn your attention inward and say k. Repeat this a few times. Do you notice if something inside you reacts? You may not fully feel it, but if you detect a slight blink, focus on that area. If your stomach moves the most, make the sound a little gentler. Be patient if you don't feel anything. Keep trying. Now, out loud, let's say the letter D. Next, try the sound T. Another sound to practice is sh. If you feel movement at one of the sounds, then focus on the spot. Repeat the sound that worked best for you. Focus on the area that is moving. Imagine that you are gently sucking air down there. Hold the air there, then sigh as you let the area release its tension. Imagine it melting. Well done! Once you're familiar with these exercises, you'll be ready to move to the next video, where we will work towards greater pelvic floor control.